Hi friends, welcome back to Complete Medical Coding. Today let's learn few more questions from the anatomical session. I had already discussed previously about the anatomical chapters and few anatomical questions. Let's learn few more anatomical mock questions. Okay. So friends, if you are new to the channel, please subscribe me, please support me, and let's go to the video. Let's move to the first question. Which place of service code should be reported on the physician's claim for a surgical procedure performed in an ASC? ASC is the short form for Ambulatory Surgical Center. So, when we learned initially the basics, we have learned about place of service, right? So, here they are asking for the place of service code, which should be reported on the physician's claim for a surgical procedure performed in ambulatory surgical center. Okay, so these are the options. Option A 21, option B 22, option C 24, and option D 11. So place of service, which place of service is represents the ambulatory surgical center? That is 24, which is option C. Okay, so the answer is option C. 24 is the place of service that represents the ambulatory surgical center. Now let's look into the other options. Let's just learn which place of service represents 21. Which place of service represents 21? 21 represents an inpatient hospital. The option A, place of service 21 represents the inpatient hospital. Okay. Option B 22, outpatient hospital. The place of service 22 represents the outpatient hospital. Place of service 24 represents ambulatory surgical center. And the last option, place of service 11, represents office, the physician's office, office location, other than a hospital, skilled nursing facility, military treatment facility. So the office location other than a hospital or a skilled nursing facility, that is place of service 11. So here ambulatory surgical center represents the place of service 24. Answer is option C. Now, second question. If an AMI is a short form of acute MI, acute myocardial infarction. Okay. If an AMI is documented as non-transmural or subendocardial, but the site is provided, how is it reported according to Isen CM guidelines? Okay. If an acute MI is documented as subendocardial or non-transmural, but the site is already mentioned, then how it is reported? If in the question it is like this subendocardial, then the answer is option B as a subendocardial AMI. Okay, non-transmural or subendocardial. So we cannot represent it as STMI or NSTMI, non-STMI. It is, the answer is option B. We will be reporting it as a subendocardial AMI. Now, moving on to the third question. Which of the following is an example of a case in which a diabetes related problem exists and the code for diabetes is never sequenced first? So, 4 options are given. In that we have to identify which case is represented is an example which shows diabetes problem exists, but we cannot code for the diabetes as a primary. Okay, which option is that? The first one, if the patient has an underdose of insulin due to an insulin pump malfunction. Second, if the patient is being treated for a secondary diabetes. No. Option C, if the patient is being treated for type 2 diabetes. No, even though it is secondary diabetes or type 2 diabetes, we will code it as primary only. Okay. Option D, if the patient has hyperglycemia that is not responding to medication, in this case also we will be reporting it as primary. So which case we should not report it as a primary? If the patient is having underdose of insulin, the answer is option A. If the patient is having underdose of insulin due to an insulin pump malfunction, then we will never code the diabetes as primary. Okay. We will code the insulin, the underdosing of insulin as the primary. Okay. Moving on to the fourth question. Which of the following statements is true regarding sequencing of external cause codes? Which is true regarding external cause injuries or external cause codes? When we should code external cause codes? Okay. First option. External cause codes for place of occurrence take priority over all other E codes. External cause codes for the place of occurrence means in which place the external cause, the injury has occurred. No. Option B. External cause codes for medical history take priority over all other E codes. Medical history, if there is any medical history which takes priority, means which we need to code first. No. Option C. External cause codes identifying screening exam as the reason for encounter take priority over all other E codes. If there is any screening examination. No, that's also not the answer. The answer is option D. Let's see, what is it? External cause codes for transport incidents take priority over all other E codes except cataclysmic events and child and adult abuse and terrorism. Yes, this is the correct answer. We should always code the external cause codes for transport incidents first. If it is a transport incident or a transport accident, we have to code the external cause code first. Okay. Except for cataclysmic events, means some disasters, some natural disasters or child and abuse. Child abuse and adult abuse also we will not code. Even terrorism also we will not code. So which are the things that we will not code first for an external cause codes? Terrorism, child and adult abuse, cataclysmic events, natural disasters. Okay. This we will not code the external cause codes first, but we will always code the external cause injury if the external cause it is caused by a transport incident. Okay, so the answer is option D. Now fifth question, which statement is true about Z codes? This is an important question. Okay, option A, Z codes are never reported as a primary code. Is it so? No, right? Z codes can sometimes be used as a primary also. Z codes are only reported with injury codes. No, Z codes are not only reported with injury codes. Option C. Z codes may be used either as primary code or secondary code. Yes, it depends on the condition. Z codes can be used either as a primary or secondary. It doesn't mean that for anything we can code Z code as primary or secondary up to our wish. No, it's not like that. Depends on the condition. Okay. Option D, Z codes do not have to correspond with procedure codes. No. So the correct answer is option C. Z codes can be used either as a primary code or a, okay, depends on the condition. Now moving on to the sixth question. Which of the following is true regarding Isen codes with the words in diseases classified elsewhere in their descriptions? In diseases classified elsewhere. If you see the ICD book, you will come across this term. Okay, in diseases classified elsewhere. So which of the following statement is true with regard to that sentence? Option A, they can never be the first listed code, which is true. We cannot code it as a first listed code. Okay. Option B, they should always be the first listed code. No, we cannot code it as a primary code. Option C, they are unspecified codes and should be used only when more specific diagnosis cannot be found. When more specific diagnoses are not found, are we using unspecified code? No, we will code the symptoms in that case, right? We cannot code it as unspecified, but it depends on conditions. Sometimes we will use it, but not like in diseases classified elsewhere, but we will code it as unspecified only. Anyway, the conditions, the diagnosis where you come across in diseases classified elsewhere, we will never code it as a primary code. We will never code it as a first listed code. So the answer is option A. They can never be the first listed code. Okay. Now 7th question. Which statement is true when reporting pregnancy codes? This is also important one. Option A. These codes can be used on the maternal and baby records. No. Option B. These codes have sequencing priority over codes from other chapters. I'll come to this point later. Option C. Code Z33.1 should always be reported with these codes. It is not necessary that we should always code Z33.1. Okay. What is Z33.1 ICD code? It represents a pregnant state incidental, but it's not necessary that we should always code that one. Okay. That's also not the correct one. Option D. The 7th digits assigned to these codes indicate the complication during pregnancy. No, every time it will not be, it doesn't indicate the complication. It depends on the condition of the patient, whether it's a complicated pregnancy or not. So that is also not the answer. Let's move to the option B, which is the correct answer. These codes have sequencing priority over codes from other chapters. What does it mean? These codes, pregnancy codes, should be always be the primary code. Sequencing priority means pregnancy code. Which are the pregnancy codes? O codes. Maternity codes are O codes. So always O codes should be the primary when compared to other chapters or while coding along with the other codes. You have to code always the O code as the primary code. Okay, so that is the answer. Answer is option B. Now 8th question. What is the correct code to select when a patient is given oral contrast to complete a CT scan? A patient has been given oral contrast while doing a CT scan. Okay, so which is the correct code that we have to use? Option A, select the code that includes with contrast in the description. Option B, select the code that includes without contrast in the description. Option C, select the code that includes without and with in the description. Option D, select the code for the scan without contrast and a code for oral administration. First, you have to understand what exactly the question means. Let's read the question once again. What is the correct code to select when a patient is given oral contrast to complete a CT scan? So it means along with the description or along with the documentation mentioned in the question, finally it is mentioned as the patient is given oral contrast to complete a CT scan. Okay, so it means in the diagnosis it's already there. It's already included. Oral contrast is already included to complete a CT scan. So which will be the correct answer? If oral contrast is already mentioned, we have to select the code that includes without contrast in the description. So the answer is option B. Select the code that includes without contrast. Okay, because already in the documentation or already in the description, with contrast is mentioned. So select the code that includes without contrast. Okay. Now 9th question. Mr. Andrews, a 34-year-old male, visits Dr. Parker's office at the request of Dr. Smith for a neurological consultation. He presents with complaints of weakness, numbness, and pain in his left hand and arm. Dr. Parker examines the patient and sends his recommendations and a written report back to Dr. Smith for the care of the patient. Which category or subcategory of E&M codes would you select from for the visit to Dr. Parker. So here we have to code the evaluation and management code for Dr. Parker. Okay, means not the code, they are not asking the code in this question. From which section that we need to code. So who is Dr. Parker? This patient has visited Dr. Parker at the request of Dr. Smith. Means Dr. Smith has referred the patient to Dr. Parker for a neurological consultation. It's only for a consultation, right? So after seeing the Dr. Parker had seen the patient, and after seeing the patient, he sent the reports, written report back to Dr. Smith for the care of the patient. So the remaining care has to be taken by Dr. Smith. So here in our question, which type of visit that we have to code for? Dr. Parker. What will be the answer? Obviously, it's only a neurological consultation. So it is an office consultation, outpatient consultation. Okay, so the answer will be option C, outpatient consultation. We cannot code it as office visit, new patient or established patient, because we don't know whether this patient is new or established to Dr. Parker. It's not mentioned in the question. And it's not case management service. So the correct answer is option C, outpatient consultation. Okay. Now moving on to the 10th question. A mother takes her 2-year-old back to Dr. Denton for an annual well child exam. The patient has a comprehensive checkup and vaccinations are brought up to date. Which category or subcategory of P&M codes would you select from for the well child exam? So here mother has taken for a well child examination and the patient has done a comprehensive checkup and vaccinations. Everything has been checked and it's up to date. Okay. So which category of P&M codes that we need to code? Is it an office visit established patient? Is it a preventive medicine established patient? Subsequent hospital care? Preventive medicine? Individual counseling? This is obviously a preventive medicine because vaccinations are done and brought up to date, right? So it's a preventive medicine. But is it option B or D? It's not individual counseling, it's an established patient because it's mentioned in the question, in the documentation, that mother takes her 2-year-old back to Dr. Denton, which means this patient is already a patient of Dr. Denton. So established patient. So the answer is option B, preventive medicine, established patient. So friends, I hope you had liked the video and it's informative. These are few important anatomical questions that you might come across during the examination. And if you find any doubts or clarifications, you can mark it in the comments and I'll be replying back to you soon. Okay. So thank you friends. Thank you so much for all your support. Please continue to support me. If you are new to the channel, please subscribe and please press the bell button so that you will be getting all the notifications. Okay. So stay tuned for more videos. Thank you so much. Bye. Take care.